Welcome to all of our participants. We're just going to give it a few minutes before we get started, a minute or two after 10 a.m. Thanks for joining. Thank you. If you're just joining, we're going to get started in a couple minutes. We're just waiting for other participants to log in. Good morning. We're just waiting for more people to join, and we will get started as close to 10 as possible. All right, we're just waiting for a few more people to join before we get started. We're watching the list go up, and a lot of people are still logging on. Yeah. All right, I think we can get started. Welcome, everybody, to our presentation, 2023 Medicaid and Medicare Saving Program Income and Resource Increases. Today, we're going to learn how we can help consumers to benefit from these landmark changes. We're joined by an exemplary panel. I'm Rebecca Wallach, the Associate Director of the Evelyn Frank Legal Resources Program. We have Valerie Bogart, the Director of EFLRP, and Kelly Murray, a Coordinating Attorney. We're going to start off right now with just sort of a general overview. So the first slide, Kelly, is some housekeeping. All participants are on mute. We are going to stop at different sections throughout this presentation to answer questions. To do that, please use the question and answer function in the menu, that the menu, there's a drop, trying to explain the little box. You need to click on the thing that says questions, open that up. You can type your questions in there. Similarly, in that same little GoToWebinar menu box, there's a heading called Handouts. If you open that up, you'll find a copy of today's PowerPoint, along with an Excel sheet that helps with Medicaid budgeting and an appendix of a number of forms that we're going to be reviewing. If you have problems with this webinar, we have an email here, cle@nylag.org, for some technical assistance, or you can write in using the questions and answers function. We're happy to say that we have been approved to provide 2 professional practice CLEs for those who might need them during this presentation. We will be reading out 2 codes during the presentation, so stay tuned for those. And a survey link will be shared to the entire audience to complete for CLE credit. And I want to give a big shout out to Valentina Chohansky from our volunteer department at Nylag for coordinating all of that. We really appreciate it. So a little bit about Nylag, the New York Legal Assistance Group. We're a leading nonprofit that provides free civil legal services, financial counseling, and we engage in policy advocacy efforts to help people experiencing poverty. Our unit at Nylag is the Evelyn Frank Legal Resources Program. We're focused on fighting for seniors and people with disabilities to ensure they have access to healthcare and home care services to age safely in their homes and communities. We do this using a number of tactics: counseling clients directly on Medicaid and Medicare and home care services, trainings like this one for legal, social services, and healthcare professionals. We represent clients in denials and reductions of Medicaid, MSP, Medicaid home care, and fair hearings and in external appeals. And we assist clients with accessing Medicaid home care. We also have a wonderful website, NY Health Access. We have a new URL as of yesterday, which we've included at the top of this, health.wnylc.com/health. This is an amazing resource to go back to for policy updates, consumer materials, and a lot of information about Medicaid services. And we encourage everybody to use this resource, and we have links to it throughout the presentation, and we also it's also a great place to check back as we learn more information about all of the topics in Medicaid. And so now we were very happy to keep this training free to the public. There's been significant demand for it, but with your help, we can keep these trainings free. We're asking that if you are going to be requesting CLE credit, that we have a suggested donation of $100. If you are not requesting CLE, we would still accept your donation. And we have links here. We really appreciate it. It's not easy to pull something like this together, and you know, your donation can very much help. So for today's training, we are, here's an overview of the things that we're going to review, a summary of the changes, how these changes are going to be rolled out to the best that we understand it at this point, what are our priority populations with and lower priority populations with a focus on consumers with pooled income trusts. And then you'll see that we have a number of reference slides that we assume we're not going to get to today, where we go through advanced non-magi Medicaid budgeting strategies that we'll quickly review at the end unless we happen to have more time. And before I turn this over to, next slide, thanks, Kelly. Over to Val to really dive in on the new income and resource limits. I just wanted to take a minute to really recognize what a significant time this is for the New York State Medicaid program. This is a list of all of these issues that we're looking at. So the new income and resource limits are effective January 1. We've learned that the public health emergencies moratorium on closing cases will end this year on April 1st, 2023, with the first discontinuances possible in July 2023. For those who are accessing Medicaid home care, there's the new NIA, or the New York Independent Assessor, which has changed eligibility, the process to become eligible to enroll in MLTC, but also how people who are in mainstream plans or receive services through the local DSS, home care services through the local DSS, access those services. It's also changed immediate need and expedited managed care requests. We're actually hosting a presentation, a webinar on NIA specifically in a couple weeks. The LE credit's still pending, so I'll put that link into the chat to see if, and you're welcome to sign up for it. And then even after that, we have the new minimum 380L requirement for eligibility and a 30-month look back for MLTC enrollment. And those have been delayed. DOH has said that for the 30-month look back, that's at least April 2024. But there's a link here at the bottom to our website where we're putting information as soon as we hear it about when those other changes may come into effect. So just recognizing that there's a lot happening right now, but we're really focusing today on the new income and resource limits. So I'm going to turn it over to Val.
Oh, helps not to be muted. Okay, hello everybody. Wish I could see everyone who's here, but Zoom does allow us to reach a lot more people. So it's a great trade-off. So I am going to dive into the landmark increases passed in April 2022. A breath of fresh air for New York to actually expand eligibility, raising the income limit for people 65 and over, people with disabilities, to 138% of the federal poverty level, increasing the asset limit, and increasing the Medicare savings program income limits up all the way to 186% of the federal poverty level. So we'll look at more about these. Just a headline. Kelly, next slide, please. So let's just step back a little and it's like what do these changes come out of? So back in 2014, the Affordable Care Act was implemented. That was enacted a few years before, also called Obamacare, under the Obama administration, and that established a whole new type of Medicaid for younger people and people who do not have Medicare, and that's called Magi Medicaid. And they were given special rules, higher income limits, no asset test. But that did not help people 65 and over and people under 65 who are disabled and had Medicare. They were stuck in the old system that we now call the non-magi system. We also call it disabled age blind or DAB or ABD. And these rules have been around for 30 years and no, 40, 50 years. Now, there were a few people in the middle who could straddle the two groups and who could pick the better type of budgeting, and those are people under 65 who were awaiting Medicare. And there was also an exception for people who have a child or a grandchild living with them who was a minor, and they're called the caretaker exception. But otherwise, people 65 and over, younger 65 with disabilities, were stuck with old-fashioned Medicaid. And let's look at more at that. Kelly. So what does that mean? The Magi Medicaid got an increase in the income limit to 138% of the federal poverty line. Now, this wasn't so much of a big deal in New York because we also were very progressive and a leader nationally in having Family Health Plus, which also increased income limits. But for the rest of the country, that was huge. No one had an income limit of 138% of the poverty limit. And New York had also gotten rid of the asset limit for this group. But the rest of the country had not. So these were huge changes under the Affordable Care Act. But the non-magi group, and most people who joined this CLE today, we work with people 65 and over and people with disabilities who are younger. They were stuck with the old rules, which was an income limit under the federal poverty line. I mean, under. You didn't just have to be poor, you had to be less than poor. And in New York, that came out to about 82% of the federal poverty level. Now, it wasn't actually calculated based on the poverty level. There was another weird formula for it, but that's what it came out to. And a strict asset limit, which, you know, like last year was 16,800, and that was an increase from what it was years ago. So as a result, we had this two-tier system where someone who had Magi Medicaid in the first column then got Medicare because they turned 65 or they received Social Security disability for 2 years. We say they fell off the cliff. They might be cut out of Medicaid because they had some assets, but now they had a strict asset test. Or they could now have a high spend down because their income was under the Magi limit, but it was over the non-Magi limit. So now they'd have to navigate the spend down program. So voila, in 2023, our state passed the same income limit for Magi and non-Magi. They both have now 138% of the federal poverty line. So let's look at what these mean. That first line shows the 2022 income limits. You remember it was only $934 a month for a single person. It's now going to go up to $1,677 a month, and couples up to $2,268. Now, to add more confusion, right? You might wonder, why are there two lines for 2023? Can't New York make up its mind? Well, here's what this is about. The limits are now based on the federal poverty line. The feds don't release the federal poverty line for the current year until into the current year. So they only released the 2023 poverty limits last week. So that's what's on the bottom row of this chart. Those are the brand new 2023 federal poverty limits. In the meantime, our State Department of Health wanted to implement the new limits that were passed by the legislature, to go into effect on January 1st. So all they could use were the 2022 federal poverty limits. So all the guidance that was issued by the State Department of Health, increasing the limits, all the charts you've seen, use that first row under the year 2023. And those are the limits that will be in effect until the state updates that guidance, which we hope they do very soon. So in this presentation, we're using the new limits announced last week, knowing that the state will catch up, HRA will catch up and use, because these are the official federal poverty line. So just take a second to appreciate what these increases are, from 934 to 1677 for a single. Now the asset limit is also now based on the poverty line, because New York has always defined the asset limit as 150% of the annual income limit. So you do some math there, and that's why the asset limit has gone up, because our income limit has gone up. 150% of the income limit is more. So now we have 30,000 and change for a couple, and single, and 40,000 and change for a couple. That should make a big difference to our clients. Next slide. So there is probably already some questions here. These are questions that we've already been receiving since these rules were announced. People ask, can I still use spousal refusal? Yes. Can I still use spousal impoverishment? Yes. The way Medicaid income is budgeted is not changing. And I know that's confusing, because we're using the MAGI income limits. So it's tempting to think, oh, now everyone will be MAGI. But no, that's not the case. We still have a two-tier system, and the aged, blind, and disabled are still using the non-magi rules. And the good news there is that they can still use some of the good strategies in non-magi budgeting, like spousal refusal, like spousal impoverishment, like being able to use a pooled trust, and like qualifying. Even if your income is over the limits, you can still use spend down, and spend down the excess on medical expenses. So all the rules are still the same. So that's why this training is really not going through all of the rules of non-magi Medicaid. We urge you to sign up for New York City HRA, does a great program. You can sign up for on basic rules of non-magi Medicaid. This is not that presentation. The other thing that won't change is how you apply for Medicaid. Many of you have heard that there's a New York State of Health marketplace, an online marketplace, and millions of New Yorkers apply for Medicaid there and do their renewals there. Not age, blind, and disabled. Oh no, they still have to apply at their local Department of Social Services, and that's who will do their renewals. So that has not changed. Also, what's not changed is nursing home budgeting. Now, unfortunately, if someone's permanently in a nursing home, all they're allowed to keep is $50, enough to pay their health insurance, and of course, if they're married, spousal impoverishment allowances for their spouse. All the rest is the NAMI, the net adjusted monthly income, which is paid to the nursing home for the cost of their care. That is not changing. So they don't really get the benefit of these income increases. The only people who will in a nursing home are those who are short-term nursing home residents. They are in only for rehabilitation, for short-term care, and they can request what we call in New York community budgeting, which allows them, even though they're in a nursing home, to be budgeted as if they're in the community. And for them, they get the benefit of everything we're talking about today, the increased income limit. Okay, next slide, please. So let's just dig down a little bit on how do you do a Medicaid budget? We just
Right back in.
Because my understanding is that ideally we want this to be,
And go from there.
and
Thank you.
you can request
Okay.
to come virtual.
It looks like almost everyone is back in. We have almost 600. We were at 750.
Okay. You emailed everybody, Valentina, to log back in? Okay. All right. So we're just going to start, and we will go later to make up for this. We're very sorry. We don't know what happened, but we will. Hopefully, you can stay later if to make up for this lost time. All right. For the non-magi Medicaid budget, many people now under the new income limits will just skate through and not have a spend down. But we know a lot of our clients have income near the income limit or over the income limit. So of course it's in their interest to use the correct budget, take advantage of all the deductions that you can to reduce your countable income. So to do the Medicaid budget, we first always start with gross income. Union dues are taken out, too bad, sorry. You can't deduct those. Child support's taken out, sorry, can't deduct it. You have to start with gross income or taxes, and then there are deductions taken from there. In this category, the disabled, aged, and blind, everybody gets a $20 a month deduction. Whether you're single or couple, it's just 20 bucks. Then health insurance premiums. And in the later slides that are here as a resource, we have lots of ideas and tools for making sure you count Medigap premium, Medicare Part D premium, Medicare Advantage premium. Now on each of these, you can't deduct the part that's being subsidized by the government. So if you're in a Medicare savings program, you can't deduct your Medicare Part B premium because the government is paying that premium for you. So we're going to show you budgets of how you can figure that out, whether or not you can deduct that. If you have earned income, Medicaid, the non-magi Medicaid has terrific work incentives that we'll describe where basically only half of gross income is counted. There's also a special housing disregard that if you're just issue spot, was your client in a nursing home or an adult home for 30 or more days recently? Or are they in and coming out? Because if so, they qualify for an extra deduction, which can really be huge and wipe out their spend down. So you want to make sure you flag that in your intakes and as you review budgets. Next slide, please. So let's just look at it at a simple example so we're all on the same page. Alice received Social Security disability. She has her check in 2022 was $1,113 a month. So she has a spend down of $159 in 2022. But she depends on Medicaid because it reduces her out-of-pocket Medicare costs. And Medicaid gives her benefits not covered by Medicare, like transportation to her doctor appointments. And she was eligible in 2022 and was still, because her assets are well under the Medicaid limit. So for her, being in a pooled trust wasn't worth it for $159 a month spend down. It wasn't worth it. It just wasn't convenient. So she faxes medical bills every month to the surplus income program, which if you've done that, you know it is a royal pain. And as a result, she doesn't always have Medicaid because maybe it's different in different counties, but in New York City, if you fax your Medicaid medical bills in to meet your spend down, your Medicaid might not be activated until the last day of the month or even the next month. And that means she can't use Medicaid in the current month to go use transportation. So it's an impossible program to navigate. So we're praying and hoping that in 2023 she won't need it.
I just don't, we do have a poll here to run.
Okay, we're hoping that she doesn't have a spend down, and let's see what happens.
Okay, so we're going to launch a poll for folks to weigh in on what's going to happen to Alice now that we have these new Medicaid income limits. So if everyone will just start answering, the poll is in progress. What type of medical coverage is Alice entitled to in 2023? A, B, C, or D? And we'll give it a few more minutes or not minutes, seconds for people to respond. Please make a choice. All right, I'm going to close it and should see the results now. Do you see that, Valerie?
Yes, I do.
All right.
Okay. So if we tell the right answer, we'll show it with the next slides.
Right. So you see people, full Medicaid or Medicaid and Quimby were the most popular choices. So I will now hide this and Val, you can go through the answer.
Okay, so let's look at the actual budgets. Here's a 2022 budget on the left. You see how there she had a spend down because her net income was $159 higher than the income guideline. Now, her net income after you take the $20 deduction is less than the income guideline, so she has no spend down. Now, about Quimby, does this budget deduct the Part B premium? See on the bottom, it says not deducting Part B premium, $164.90 for Quimby. So we see that is not deducted here. And even not deducting that, her income is well under the limit by about $500. So she is definitely eligible for Medicaid with the spend down. I mean, with no spend down, and definitely eligible for Quimby. So who were our winners, Rebecca, on the poll? How many people got that right? Oh, you're muted. You're muted.
Thanks. Sorry. 35% chose Medicaid and Quimby.
And what answer did most people get?
Just full Medicaid. 48% thought Alice was just eligible for Medicaid.
Okay. So this is one of the big takeaways we want you to take from this program. A lot of people forget about Quimby. And now that the income limit is up, we know the $164.90 premium is automatically deducted from people's Social Security check. So many people just think that can't be changed. When you calculate budget, don't ask them how much their Social Security check is. That's their net check. Ask them from for the letter they got from Social Security at the end of 2022, how much is their gross? That's what you put in here. And then you only deduct the Part B check here if you need it to bring their income down to the income limit of $1,677. If you don't deduct it. And when you apply or when you do your renewal, you say, my client's eligible for Medicaid and Quimby. You have now won them $164.90 back in their check. They will be very happy. All right, next slide. So just a little disappointment here in the advocacy community. We had, and this didn't, the increase in income limits didn't just happen. I'm proud to say that Nylag was one of the leaders, along with other nonprofits, of a big coalition that asked Governor Hochul to repeal the asset limits and increase the income limits for Medicaid and MSP. And obviously we won a lot. We're thrilled with that victory. But we asked her to repeal the asset test altogether. And as California did recently, the big state of California repealed their asset test. And why? Because the asset test is biased against people of color. Because statistically, they don't benefit from the Medicaid rules. In New York, Medicaid, you can have a home and get home care, even if your equity in your home is over $1 million. The equity limit went up to $1,033,000 this year. You can have an IRA of $1 million as long as you're taking distributions, your required minimum distributions, and those you could put in a pooled trust. So that's not exactly a poverty program when you can have $1 million home and $1 million IRA. But someone who rents their apartment can't even save $50,000 in life savings in the bank because that's over the asset limit. Yet people of color are much less likely, for many historical reasons, to own homes and have retirement funds. So these rules favor white New Yorkers, and we demanded repeal of the asset test. This unfortunately was not enacted, and the coalition this year asked the governor, okay, if you won't repeal it for everyone, please repeal it for the Medicaid buy-in program for working people with disabilities, and at least let's substantially increase the limit. So we asked them to basically triple the limit to around 100,000 this year, because I think politically we just decided they're not likely to repeal it, and let's shoot for something that we can hopefully get. So we'll see what happens in the New York State budget. Okay, next.
Now we're going to discuss the Medicare Savings Program. So for all those individuals who did not have Alice getting QMB benefits, I fully understand, because we did not touch upon the increase in the income guideline for the Medicare Savings Program in 2023. So in addition to Medicaid, the Medicare Savings Program's income guidelines increasing and is changing a little bit in regards to the levels. So in 2022, back in December, there were 3 levels of programs, or 3 types of beneficiaries. There was the qualified Medicare beneficiary, or QMB, SLIMB, and QI1. And to be eligible for any of those programs, the guideline would be set anywhere between 100% to 135%. Medicare Savings Program does not have an asset limit, so nothing had to be changed in that. It will continue not to have an asset limit. However, in 2023, the income is increasing, and we're losing one of the levels. However, it's just be encompassing in with the first level, the QMB. So now individuals who would be eligible for the qualified Medicare beneficiary, QMB, will now have the same income guideline as those who would be eligible for Medicaid at 138% of the federal poverty level. Those who would be eligible for the QI1 level would be up to 186% of the federal poverty level. So if you're looking and you're comparing, you can see that this is a very large increase. And this program is a great way for individuals to keep an additional $164.90 in their pocket and also make them eligible for the extra help. So what is the Medicare Savings Program? It rocks. It rocks because, as I said, it's going to pay your Part B premium of $164.90 or up to $1,978 annually. In addition, it's going to get you extra help with your Part D. Part D is your medication coverage. That's through the Medicare program, through a private health insurance plan. Each of those private health insurance plans would charge a monthly premium, but extra help will pay up to $38.90 of that premium. In addition, it's going to reduce your copays. So individuals who had copays that were $35 will now only have copays of $3.95 or $8. So it's substantially decreasing a person's medication costs, and it's estimated to be about $5,000 a year. So by getting somebody the Medicare Savings Program, you will be saving them approximately $7,000 a year. In addition, it will eliminate any late penalty enrollment period. So an individual has set times when they can enroll in Medicare or Part D. If they don't enroll when first eligible, they'll be faced with a penalty. By getting the Medicare Savings Program and extra help, you'll eliminate that additional part of the premium. In addition, it will give you a special enrollment period. I'm in a drug plan, it's not meeting my needs. What do? People get stuck. I only can do it during the open enrollment period in October, so it will be changed in January 1st. No, by having this benefit, you'll be able to move out of something that's not working for you. It will give you a special enrollment period. Once again, no resource test. So we're looking at a person's income and we're going to get them the additional benefits. And most importantly, when you look at the Medicare Savings Program application, it's one page. We do have a copy of that in the appendix that we have attached, so you can look in to it so that it's one page and it gets submitted to the local Department of Social Services or HRA with supporting documents once the national health emergency is over. One additional thing is in regards to QMB, it gives you balanced billing protection. So what does balanced billing protection mean? If a person has Medicare, they go to the doctor, Medicare traditionally pays 80%, the individuals charge 20%. If you have a QMB status, if the doctor accepts Medicare, they're not allowed to balance bill you for that 20%. They must bill QMB, or if they choose not to, they cannot charge you for that additional 20%. So it's protection. You won't have to be laying out additional money for your care. The only down part is anyone who's a Medicare Savings Program as a QI1 level cannot have Medicaid at the same time. So you would have to choose, do you want QI1 or do you want Medicaid? If you want Medicaid, if you're at the QI1 level, you'll be above the income guideline for Medicaid. So then you're going to think on how you'll spend down. If you're spending down, or if you're eliminating your spend down by using a pooled income trust, you may want to just increase your deposit by $164.90. And then you will also get Medicaid with no spend down plus QMB, kind of like Alice did in our example.
Kelly, can I just ask you one question?
Sure.
Just go back to that slide. So you talked about the one-page application, but do you have to submit that with the Medicaid application? If you're
applying for Medicaid, on the actual New York Health Access application, there is a question if you want the Medicare Savings Program, you can check that off. But if for some reason you missed that question, the local Department of Social Services and HRA are required to screen you for all available programs. So if your application is processed and you're eligible for QMB and Medicaid, you should automatically be enrolled. If you're eligible for Medicaid with a spend down or QI1 in New York City HRA, you're sent a choice letter in which you would have to opt which of those programs you want to be enrolled in. Did I answer your question?
Yes, thank you.
You're welcome. So there's an estimated 300,000 individuals that are eligible to enroll in the Medicare Savings Program. So whenever you're screening your clients, your patients, anyone who, your family members, and all of a sudden they're discussing their income and you know that they have Medicare, just remember me and please, please, please screen them, because this is a wonderful benefit for everyone to get if they're eligible. The budgeting rules will follow the same rules as Medicaid. Those have not changed. The person's entitled to the same disregards in regards to health insurance, except for the Medicare Part B, because you can't have somebody pay for it, but also take it as a reduction. And this is a nice increase in regards to your income, because $2260 is a lot higher than what it was before. If you need any more additional information about the Medicare Savings Program, please visit our link so that you can learn more on how to get more people enrolled in this great program.
All right, we've had a lot of questions, but in the I'll ask a couple in the interest of time. So there's been a few Medicaid advocates who have had to train hospitals or local LDSSs, DSSs, when they're told that someone cannot have Medicaid and QMB at the same time. So I'm wondering if you guys could walk through that distinction about QI1 versus all the other MSP programs.
Are they saying that the person can't have QMB?
So here's one. I've had several clients kicked off MSP once approved for community Medicaid, was told they are not allowed to be on both programs.
Oh, boy.
Yeah, that is incorrect. The only time it could have been a question was if it would affect whether they would have a spend down or not. Once again, in HRA world, if you would be eligible for the QMB, but it would affect your Medicaid budget in that you would, if you don't have the deduction, you would be below the guideline, but if you did have the deduction, you would be below, sorry, I said that backwards. If you had the deduction, that would make you below the income guideline. If you didn't have the deduction, you would be above it, but would have a spend down. So the person should have an active choice in deciding which program, if they wanted to have a spend down or QMB.
Right, but a consumer could never have QI1 and Medicaid.
Correct. That's the only program that they cannot have, QI1 and Medicaid. If they're having individuals or a set hospital and it's all the workers, then obviously there's something wrong with the training, and you can bring in one of the articles that clearly say it with the regulations that show that you cannot have QI1 and Medicaid, but it does not mention the other level.
Okay, and a lot of the other questions are in our next, we're going to answer in our next session, so I think we should move on.
Okay, So now we're going to talk about how is this happening, and that's why you're here, because it's January 18th. And next slide, Kelly. Okay, let's. So DOH, our Department of Health, has issued a lot of guidance. There are conveniently copies of each of these in your appendix. They're short. So if you're an advocate, we urge you to read these, like that's it. You just have to inform yourself on what's happening. New York City issued a Medicaid alert, and we'll be discussing that a lot because that explains how they're asking people to request rebudgeting. So here's the bad news, okay? It's January 18th. Our fantasy, our dream was that everybody would wake up on January 1st or by January 18th and see that their spend downs have been reduced or vanished because the state had said that they might be able to do a mass rebudgeting of everyone's Medicaid. If you had a $500 spend down in 2022, they would enter a few keys in the computer, and voila, in 2023, it would be zero. Wouldn't that have been nice? They said they couldn't. They said the computers, unfortunately, are about 40 years old, and they just couldn't do the programming. So here's what we're left with. So there's a couple of different forces going on. We have our new limits that we're all excited about, but at the same time, we've had a little thing called COVID for the last 3 years, and the federal government had declared a public health emergency and gave states billions of dollars of Medicaid dollars to deal with it. And what did states have to do in return? It's the top block on this slide. It was a Families First law said there is a moratorium on Medicaid case closings and reductions. States cannot close Medicaid or reduce it. And what does it mean to reduce Medicaid? It means increasing their spend down, right? As long as the public health emergency is going, unless they move out of state, they die, or they voluntarily close their case. So for 3 years, no one's Medicaid should have been terminated, even if they won the lottery and now have $500 million in their bank account. Even if their Social Security went up, so normally their spend down would have been going up for 3 years, the state and the local Medicaid offices were not allowed to increase the spend down. So what's happening? Just in late December, Congress passed an Appropriations Act that said, all right, the party's over. This is over. COVID is under control enough. We are saying we're going to turn the faucet back on. States can start terminating Medicaid after they process renewals for all Medicaid recipients over a 12-month period. So this has been nationally called the unwinding of the public health emergency. And it's a big deal because people haven't gone through renewals for 3 years. And in New York City, it's been confusing because they've sent out the renewals anyway, but they didn't process them. They just went to a big pile because why process them if they weren't allowed to do anything adverse to the client, right? They couldn't cut off their Medicaid, they couldn't reduce their spend up. So no one's been through renewals. So it's going to start. The mail renewals will start being sent out in March in New York City and in April in the rest of the state. And they're going to divide the whole Medicaid population of 8 million people in 12. So just think about that. It's about 800,000 renewals are going to be sent out in every month of 12 months until everyone gets their renewals. And then, now this also is on the New York State of Health Exchange, right? This is not just non-magi. This is non-magi and magi, all right? The mail renewals are non-magi clients. So, so as we know, when you get a renewal, that always gives a deadline that says, if you don't return this renewal by X date, we can cut off your Medicaid. So that's going to start. And those first terminations can start on June 30th of this year, like effective July 1st in New York City, and a month later in the rest of the state. And of course, before they discontinue Medicaid, they have to send a 10-day notice before. Now, we got this information in something the state sent out called the unwinding timeline. That's in your appendix, pages 29 to 31. So you can see more detail on where we got these dates. And this just came out last week. This is very, very fresh information. So when they process the renewals, when your clients and you help people fill out these renewals with their current income information, with their 2023 required minimum distribution for their IRA, the new limits that we've been talking about will be applied. So the good news is, for most people, their spend down is going to go down from what it was. Now, it won't go down as much as the income limits going up, because people have had COLA increases for all these years, right? Everybody's, this year it's 8.8% or 8.7%. So every year people have had, and their spend down hasn't been going up. So we're very grateful for these increases, because people won't get an increase in their spend down. Okay, next slide, please. So help your clients. These renewals for non-magi are still being done by mail. There's no email, no online, not like New York State of Health where people get an email, they even get text. It's so high tech. We are not high tech in the non-magi world. It is paper. Now, many people moved in 3 years. Just think of it, the last renewals that counted were sent in 2019. So if your client moved since then, help them update their address with your local Medicaid office. And in New York City, there's a particular form, there's a fax number. It makes it very easy to do it. And we have an article with more tips on renewals, on helping people complete them, and just best practices on the website. And do this now, because they're going to start, those mailing lists are already probably being assembled. It might even be too late. But you'll always be able to get a copy of the renewal, though, if your client opens an account on what's it called, Access HRA. So the Access HRA website has copies of the non-magi Medicaid renewal. So just Google Access HRA, or maybe Rebecca could put that in the chat. The link you can help your client open an account there, and if they don't get their renewal, you can always download a copy of it. Now the renewals, one question we get is, well, my client got a renewal this month in January. That's due in March. Do they have to send that in? No, because it won't be processed. The first ones that will be processed are the ones sent on the deadlines, the timeline in the last slides. March, I think for New York City, April, upstate. So the ones sent out before then are still under the old rule where they're not really processing them. I mean, we still always advise people to send them in because we don't want people to get out of the habit of sending them in. But we know that those are not the ones that are going to be used. The ones due now or next month are not the ones that are going to be used to put in, to evaluate under the new income limits. Next slide, please. So for new applicants, they should have their applications evaluated under the new limits. So that's in effect now. The local districts were told that. Now, there is some ambiguity about how about an application that was filed mid-December and is now being approved in mid-January. Well, the state directives don't really say, but we were told that the state told the Medicaid agencies that any application that they're approving in 2023 should use the new limits. Unfortunately, we can't point to a directive that says that because the directives do not say that. So if you have problems with it, you might reach out to us. Certainly reach out to, go up the chain of command at your local district and say, hey, we heard that DOH told local districts to use the new limits for applications being approved after January 1st. Okay, and so try that first. So another thing that's changing for applications is there have been special rules, like we call easements, for applications filed since March 2020. They were really simplified. You didn't have to include documentation of your income, your assets. They used something called attestation. The consumer could attest just by signing the application that everything that was in the application was true. When they wrote down that their RMD was $5,000 a year, they took their word for it, all right? There were a few things that they still had to prove, like citizenship, ID, but those rules will be ending, and according to the unwinding timeline that's in your materials at page 29 of the appendix, the applications through May in the city and June outside the city are still under those old rules. So you can still use attestation. But starting in these months, June in New York City and July upstate, goes back to, we're rejecting your application because you didn't include proof of your pension. Okay? So, and for nursing home applications, 5 years of bank statements haven't been required for all these 3 years because the client could attest. No more after these dates. These are the key dates. So start preparing for that goes back to full documentation. Okay, next slide. So this is the big choice you're going to help clients with. All right. Which option are they going to use? So option one is that, as we said, everybody on Medicaid is going to start getting renewals in March or April. I mean, depending on upstate or New York City, that they'll have to send back, and then the new income limits will be applied. Now, that's a 12-month period. These are going to be stretched out. So some people are going to be in that first batch. Some people are going to be in the last batches. they're not going to get those renewals till 2024. If they want their spend down to go down, they might not want to wait till 2024. That's where option 2 comes in. Option 2 is they may request a rebudgeting using the new limits sooner than they're getting the renewal. Okay, that's what those state directives said. The state directives that are in your appendix and are in that slide, they all say, in fact, well, let's go to the next slide. So in fact, the state had all the local districts send this notice that's on slide 29, and it's in your materials, to every Medicaid recipient who has a spend down or has a pooled trust, got this notice from the state. I mean, it's from their local district, but it's really from the state saying, all right, these are the new limits, but we're not going to apply them to you till you go through the renewal. You can contact your local district sooner if you want and ask them to recalculate your income. And if they don't, it will just be recalculated at your renewal or the next time you talk to us, that you have a connection to us. So that's the option B notice. Next slide, please. If you're in New York City, HRA sent that same group a second notice. And this is all in your materials. This is at page 18 to 21 of your appendix that says, we're even going to provide you a form for you to send back to tell us you want a rebudgeting. And the form has a line, put in your income, and it has a line, put in your deductions. So, and it has instructions on how to return it. That when people get this form in the mail, they'll get it by snail mail. It'll include a business reply envelope. HRA is asking people to return this form in that envelope because it's barcoded and will be sent to the right unit where the client's case lives. They said that will be the most efficient. So we have a few problems with HRA's form. Like, we don't think it's done so well because it just has one line, tell us all your income, and one line, tell us all your deductions. So we went through the budget before, and it really helps to sort of line out and break down the types of income, especially if someone works. I mean, earned income is budgeted very differently, and we have slides on that later on. So we've developed a supplement budget on page 41 of your appendix. It's our own supplement that you can use. If you print it out, it has lines for the different types of income. It has lines for the different deductions. You could just attach that to when the client submits it so that you can say, all right, I think the spend down is going to be X, and here's how I calculate it. So that's something you can do. Monroe County also issued a form, and that's in the appendix. We've put up a Google sheet that lists every county, and you could check that out to see if anyone on our various listservs has put in specific instructions for your county on what to do. Because we've heard some upstate counties are, hey, just give the caseworker a call and they'll do the rebudget. Like, That sounds good. We don't have that in New York City. But you can open up that spreadsheet, and if you have experience in your own county, add it in. This is a crowdsourced spreadsheet, and it's the more people who add information about your county, the better. Okay. Oh, so this slide just takes from the HRA alert that says, what do you do if you lose that envelope? And it says, well, you can fax the form if it's a spend down case or if it's a nursing home case. Now, reminder, if it's a nursing home case, the only reason to fax this form is if the client is in that community budgeting, is not in chronic care budgeting. You certainly want to do that because that allows the client to keep a lot more income in community budgeting. Unfortunately, for those getting home care or MLTC, they didn't give a fax number. They just said, if you lost the barcoded envelope, they gave an address to mail it or to drop it off at the Brooklyn Medicaid office, which we're not too happy about, but that's what they said. All right, Kelly.
So in addition to individuals who have Medicaid spend down and we're going to get a letter, the Department of Health sent letters to individuals who have the Medicare savings program, not Medicaid, and were informing them that they had the opportunity to upgrade their coverage. If you remember when I went through the income guidelines, this would include everyone who had the Medicare savings program in December of 2022, because based on the increase of the income guideline, everybody now who had the program has income that's below the 138% of the federal poverty level. So everyone's going to get a letter. HRA did not send a separate letter. This is only the Department of Health letter. Within the letter, it tells you to call your local agency to upgrade or to ask them what you should do. And this would be, they could either be upgrading to include Medicaid plus QMB or just individuals who want to upgrade to QMB based due to their resources. Because once again, QMB and QI1 do not have an asset limit, whereas Medicaid does. So what are you going to do, or how are you going to help these individuals? If they want their case to be upgraded to include full Medicaid and QMB, the Department of Health is requesting that all these individuals complete a Medicaid application with a supplement A. And that's because they originally had the Medicare savings program. The local Department of Social Services, or HRA, do not have their resource information, which would be on supplement A. In addition, they may not have the most recent income information. So that would be a full Medicaid application. Up until June or July, you could attest. After that, you should be submitting with proof of all that information. To upgrade to QMB from SlimB or QI1 only, you should submit a Medicare savings, an MSP application, which is the DOH 4328. And that can be, both of those documentations can be found in the appendix. We have an application, a supplement A, along with a Medicare savings program application. In New York City, you can fax the applications and upgrade requests to the phone number, to the fax number that is posted in this on the slide. In addition, it's also in the guidance from New York City HRA. So let's go through an example of what we're talking about, because I know we're throwing numbers at everyone, so it's always better to see an example. And we're going to discuss Roger. Roger in 2022 had a Social Security disability payment of $1,500 a month. He had QI1, which means that the $1,500 a month was his gross and his net, because nothing was being deducted, because QI1 pays your Medicare savings program. He does have countable assets over $42,000. Why is that fact important? Because whenever you're speaking with individuals, you want to screen for Medicaid as well as the Medicare savings program. So $42,000 is above the new resource guideline of just over $30,000 a year. In 2023, his Social Security disability has gone up to $1,630.50, which is under the Medicaid limit. However, once again, his countable assets are above. So we know that we want to see if he can upgrade from QI1 to QMB. And now, why do you want to do that? Because we want to get him the balance billing. We don't want him to be responsible for that 20% or for that copay if he's in a Medicare Advantage plan. So Roger is eligible for QMB, and that's based on his Social Security of $1,635.50. He gets his Medicaid disregard that everybody gets of $20. If he has other health insurance besides his Part B, we would take those deductions, whether it's a private paid dental, vision, an employer, a retiree insurance, if he has a Medicare Part D plan that's above the extra help amount of $38.90, that difference can also be deducted. If he's in a Medicare Advantage plan, we want to see if he has any additional fees that he has to pay, such as a health fee or a health premium. We would take those deductions. Once we've done the math, we see what his net Medicaid income is, and we compare it to the income guideline, which makes him QMB eligible. Just note, if his resources are kind of close to that $30,000, there might be some, quick tips of how he could get below, such as purchasing a prepaid funeral arrangement or other options. And you can certainly look in health in the website for anything in regards to being over assets in our articles.
Okay, so some of the questions are going to be answered in the next section. There have been a few questions about pooled trusts, but one recurring question is, once you submit the request for a rebudget or an application to upgrade from QMB to full Medicaid, how long does the local Department of Social Services or HRA have to review that and come to a decision?
I'm answering 45 days unless a disability determination is needed.
So, yep, that is the answer that I thought as well, that they would have 45 days to do so. And there was one commenter who said that she was told when she contacted the HRA helpline that the reprocessing would happen in 2 weeks for a client that was moving from SlimB MSP to QMB. But I think our general guidance is to be vigilant and to set those deadlines so that you're following up on your client's behalf after that time period has passed. And so in light of the time, I think we can move on to the next.
How would you follow up, Rebecca?
It's easier in smaller counties for sure. In New York City, you could call the helpline. And in certain cases, I think you could consider requesting a fair hearing.
Okay.
CLE code. Our first CLE code is QMB. QMB, Qualified Medicare Beneficiary. We've been talking a lot about this program today. Remember, it rocks. So the code is QMB. UMB. I think that's enough time. We can
Yeah.
move on. This goes to you, right, Kelly?
This comes to me. So high priority cases for rebudgeting. So we've been told 150,000 people. We've been told all different numbers. And if any of you are like everyone at the Evelyn Frank Legal Resources Program, we want to help all 150,000 people, plus all the new people. And we have to be aware that we cannot possibly do that. It's 140,000. So we recommend that you prioritize who you can actually assist with the rebudgeting. You can certainly provide guidance and directions of what individuals can do, and then prioritize who you are going to help with and who you're going to give some additional assistance with, and then who you're just going to be providing guidance. We have taken the approach that those who already have a spend down with a pool trust maybe don't need to rush to the front of the room and request their rebudgeting immediately. They can do a rebudget themselves and possibly reduce their spend down to their trust organization. However, hold off on actually asking for the request, but I'm going to go through that in depth on the next slide. So who is in the high priority? Obviously, it's those poor people who are faxing in their bills to meet their spend down, or those individuals who are mailing in or making a credit card payment to meet their spend down so that their Medicaid is activated. We all know there's a lot of kinks in that system. They're doing it timely. Your local Department of Social Services, HRA, is trying to process them as quickly as possible, but things happen. So they're setting it in, but they're not, their Medicaid isn't actually open. They're not getting their Medicaid transportation until maybe the third week or the fourth week, or not at all that month because it wasn't processed quickly. So we think these individuals have a high priority. We want to get their case rebudgeted as quickly as possible so they don't have to do steps 1 or 2. Unfortunately, they will have to continue to do that until they get the golden ticket and a notice that says you now have a 0 spend down. And hopefully it will be retroactive where, you know, we've heard verbally, yes, but we have nothing in writing. So we can't say with 100% certainty that it will be retroactive. If it is, then they should be entitled to a reimbursement. In addition to the pay-in and the faxing of the medical bills, we have those individuals who are SLIM-B and QI1. Just as I keep saying, we want them to get full QMB and we want them to get full Medicaid so that they can go to their doctors and not worry about how they're going to pay either their Medicare copay or their 20% coinsurance. And then we want to look at where are they in their cycle. You're going to say to them, do you remember when you recertify? And the person's going to say, oh yeah, I get my paperwork every November. Okay, well, November, that's a long way away. Maybe we want to help them to speed up the process so they get their budget. If they're telling you, oh yeah, I get my renewal every May, you know, maybe step back. There's no reason to contact your local Department of Social Services or HRA now, because in May it's going to be done. Now, if they want to do it, then you talk them through and have them do it themselves if you don't have the time to assist them. So individuals with a pool trust and no spend down, I touched upon that briefly earlier. It is our interpretation that they can reduce their amount that they're depositing into their trust. They're going to do you're going to help them, or they're to do a mock budget based on your income guidelines. You're going to go through, you're going to confirm with them what their gross income is. You're going to confirm what health insurance they're paying for, and you're going to give them an amount. And you're going to say, okay, this is what I believe your new spend down amount is. Based on all this, they're going to confirm that's the information. The only thing that's changing is the amount of money that they're depositing in their trust. They currently have full Medicaid. Whether their budget stays as is or rebudgeted with that spend down, they will still have full Medicaid. So there will be no change in their coverage. So they can continue going until it's time for them to recertify. When they recertify, they'll be providing with documentation showing their new spend down amount, which their new deposit amount, which will meet the new spend down. Now we've heard that some people are saying their trust organizations won't do it, but there is nothing that can stop an individual for changing the amount they want to deposit into their trust. They are voluntarily changing and they can. So what is a pooled income trust? A pooled income trust is a supplemental needs trust that are available for people, for individuals with disabilities of all ages. Anyone who's 65 or older has to use a pooled trust. It's through a third party, a nonprofit third party. If you're under the age of 65, you can use an individual trust. But pooled trusts are through a third party. And it's a way in which a person, when they are getting Medicaid, if they were to have a spend down, instead of spending that amount of money on or mailing it to the local Department of Social Services so that Medicaid is turned on, or submitting medical bills and sending it to their doctors or their medical providers, instead they can send that amount on a monthly basis to a third-party trust organization, who's then going to put it in an account for their benefit. The third-party agency will take a fee, but it won't be 100%, and any money that is in that trust account, the Medicaid beneficiary can say, I'd like you to pay my rent. I'd like you to pay my Spectrum phone, internet, cable bill. I'd like you to pay my Con Ed. They cannot write a check directly to the beneficiary. It has to be for any non-medical living expenses so that the individual can stay in the community. So we're going to look at Paula. We're going to use 2022 budget because I know when you're talking about a spend down, it gets very murky. So in Paula's case, she had income of $1712. She paid her Medicare Part B. She had a Medicare policy and of course her $20 disregard. In 2022, her net income was $1334. The income limit for a single was $934. Her spend down was $400. So she could mail $400 to Medicaid and then she'll get her Medicaid coverage. However, you know, Paula's going to say, I don't really have this money to send for my Medicaid. I need to pay my living expenses. So then you would talk to them about a pooled income trust. You would then redo the budget. And instead of doing $400 to Medicaid, you would do it $400 to the pooled trust. You would redo the person's Medicaid budget and you would see that they have a spend down of $0. Then you would say, you know what, Paula, how are your bills? Do you have bills? You know, you're telling me your rent is $320. How much is your Con Ed? How much is your Spectrum? What is your living expenses? Would you benefit by increasing your deposit by $170.10 to pay some additional bills? If so, why don't you do that? That would free up $170 for you to use for yourself, using the pool trust to pay those bills, and your Medicare Part B would be paying for you. Now, if you had somebody who had large expense, had a large spend down and not a lot of living expenses, they might say, you know what, it doesn't matter. I don't want to give it to the pool trust organization. I'll just keep paying my Part B. But there is that option. She can add up the additional Part B premium to the spend down and then get the benefit of someone else paying for your Part B and be eligible for QMB. So how do help consumers reducing their deposit? Once again, you're going to calculate their 2023 budget. You're going to get all their gross income. You're going to get any other income that they have. You're going to get any of their health insurance premiums. You're going to determine those amounts. You're going to determine using the proper income guideline of 138% of the federal poverty level. And you're going to determine what their spend down is. They're going to confirm all your information is correct. You're going to come up with a proposed 2023 budget. You're going to tell them that based on that, they can contact their pool trust organization and let them know that they'll be reducing their deposit to that amount of money. If it is zero, they can tell their pool trust, you want to make sure the balance is as low as possible, that they are going to stop their monthly budget. You want to make sure that the amount in the trust can cover that particular month's worth of fees, and then you will close out your pool trust account. Then when it's time for recertification, your renewal, you will include all of that information to HRA or the local Department of Social Services. So practical considerations.
Okay, all right, sorry, I was muted.
That's okay.
Oh, are you doing this?
No, but yours. I would have done it if you didn't jump in.
Okay, all right. So just as a practical matter, let's say let's say her spend down is still $400, but her rent is $600. So sometimes it makes sense to put in the full $600 and the extra enough to pay the monthly fee of the trust if it just makes sense for the trust to write the full rent check, right? Because if her spend down's 400, her rent's 600, she puts 400 in, let's say the trust fee is 20 a month, that means there's 380 in the trust to pay her bills. So rent is always the biggest ticket item, right? It's the expense that makes the most sense for the trust to pay. So even though when you're doing your 2023 budgets, you just want to make sure there's a plan for if the consumer now has enough money in their account to pay the rent, great. If you're closing down the trust, then fine, the consumer will start paying their rent again. But if you're just reducing the amount of deposit into the trust, you want to think about who's going to pay the, why is there an echo? Do you hear an echo? Oh, I do. Okay. Who's going to pay the rent? Is it the consumer or the trust? Just have a plan for that. The other thing, and Kelly pointed this out, but we can't stress it enough, you can always think about putting an extra $164.90 into the deposit. And then you no longer deduct the Part B premium from the income. And now, yes, they're putting more into the trust, but that means there's more for the trust to spend on their bills. So they're saving $164.90 by doing that. So each case has to be really evaluated on what bills is the client going to use the trust for, and that's where your expertise and your counseling comes in. So we're going back to Paula. All right, we talked about her before. Her 2023 income is $1,862. Can she stop using a trust, or can she reduce her deposit in 2023?
All right, I'm going to run the poll and everyone can weigh in. Here it comes. So there's only two options on this one. Does Paula need to continue to contribute her to her pooled income trust to keep Medicaid without a spend down?
And just a reminder, we think she had a Medigap deduction, right? Of
That's
about
correct. Yes.
180 something.
All right, I'm waiting for a couple more people to vote. All right, and I'm going to close this and we'll take a look. And so it was
Wow, 50-50.
50-50. All right, and now I'm going to hide this, and Val, you can walk us through the answer.
All right, well, let's look. So we're telling you the answer first, that yes, she can stop her contribution to the pool trust and have it all. She's going to have no spend out, and she'll have Quimby. So let's look at the budget. So we start with her gross income. We are not deducting the Part B premium, right? But we are deducting her Medigap. We're not deducting a pool trust deposit because we want to see how it works if she stops it. Her net income is $1,654, just $20 under the Medicaid limit. Now, all right, another practical consideration, all right? In this case, now maybe she'll decide, I want to get rid of the Medigap too. If she got rid of the Medigap, would she have a spend down? Yes, right? Because if you stop deducting that $187.90, then her spend down will be about $187.90, more or less. Another thing to think about is she is so close. She's only $20, $23 under the limit. It might be worth it to her to keep the trust open even without depositing it, just pay the monthly fee. It's something to think about. If the minimum monthly fee is low, like most trusts have a sliding scale fee. So with the lowest fee with the minimum deposit. Let's say you use, I think the NYSARC trust is a $30 minimum fee. The CDR trust is a $20 fee. Let's say you stop depositing for now, but we don't know what the COLAs are going to be next year. The federal poverty level is going to be in 2024. We do know that setting up a new trust and getting it approved is a royal pain, because no matter what age you are, now she's young, has a disability, not hard to prove disability. You just show you're on Social Security disability. But how about our 80-year-old clients? They have to prove that they're disabled. That's a huge amount of paperwork. So, if you're in this border zone, think about it in your counseling. You're giving your clients an extra benefit of your wisdom to say, you know what, you're so close. Let's reduce we can stop contributing your spend down. Let's just reduce your deposit to 20 a month or 30 a month. It's worth it just to keep the trust open. Now, you'll need to, each trust, let's look at the next slide, Kelly, because I think it talks a little bit about this. Oh, well, okay, it doesn't. So each trust has different rules. Do you have to keep a minimum deposit in? There's like 20 pool trusts in the state, and we're not going to, we can't go through the rules on all of them. Talk to your pool trust. Is it okay? You tell them, this is your plan. I'm just reducing my deposit just to keep the account open. They might require a minimum deposit to be kept in there, $200 or something. Think about it. If your clients really close to that income limit, it might be worth just keeping it open. But they're still going to be very happy because they're not putting $500 a month in anymore. They're only putting in 20 or 30 a month. And if you put enough in to have the Part B premium, they have $164.90 in their income, in their check. All right, let's just look at a couple's budget just to reinforce. Couples are the same. If both people in the couple are 65 or over or disabled, we just count them, all of their income, count all of their deductions and use the couple income limit. So this couple, Morgan has Medicaid, Chris is a community spouse. They they did not use, okay, we see that they did not deduct a Part B premium. When we don't see a Part B premium deducted, we think, aha, they are on QIMBY, because the QIMBY limit in 2022 was $1,526. So their net income is under that, and their net income is just at the Medicaid guideline. So in 2022, with their 793 pool trust deposit, they were fully eligible for QIMBY and for Medicaid. So they had a very good advocate who advised them, put in that extra money, that Part B premium, into your pool trust, which the 793 includes, and that way they can have more money in their check by getting QIMBY. All right, let's see what happens to them in 2000. Okay, there's it. All right. Let's see what happens in 2023. So first, the column A is doing their budget without QIMBY. Their checks have gone up a lot with all the COLA increases. So they have almost $3,000 a month income between them. If we deduct their Part B premiums and we stop deducting the pool trust, that's the first one we always want to try to do. Let's just start and see what their budget is. So their net Medicaid income is $2,235, which is under the Medicaid guideline. So if they don't do QIMBY and they say, okay, option A, we're just going to pay for our Part B premium, but we're so happy to stop using the pool trust, we're $30 under the limit. In option B, they say, geez, why should we pay the Part B premium if the government will pay it for us? So we're going to stop deducting that. We know it gives us a spend down, because without that deduction, their income, their net Medicaid income is higher. So they are now over, but it's worth it to us to put $297 into a pool trust, because that's $297 that we were paying to the government for the Part B premium, and now it can pay for our cable bill and our cell phone bill. So we're thrilled to do the budget with QIMBY, and even though we're still going to use a spend down, and as we said before, when they're close to the limit, it's probably smart for them to keep a pool trust anyway, because we don't know how the federal poverty levels and the COLAs will play out next year. Maybe they'd have a spend down anyway, and then one of them would have to open a new pool trust. So we've saved them that grief. Next slide. So as Kelly previewed before, for some people, their income is going to be comfortably under the 2023 limit, enough that they can be confident that they won't need a pool trust going forward. I mean, for some people, it's going to be hundreds of dollars under the limit, right? All right. Well, what do you guys think? Maybe 100 or more, you could be pretty comfortable that you're going to be okay under the COLA in the future, and you could start closing it down. So now we've made up these process to close a trust by our legal reasoning, right? That you can stop depositing income to the trust, because Kelly said this is a voluntary thing. If you decide to deposit, you could decide not to deposit. You want to submit expense requests to spend the balance in your trust down to whatever the minimum deposit the trust requires. And you want to reach out to the trust, of course, to tell them what you're doing and follow their procedures. Now, as long as you keep the trust open, there is a monthly fee. So that's where you're just going to work with the trust to deposit it. Now, as Kelly said, some trusts we've heard are telling people, we won't let you close the trust until you show us that Medicaid has been rebudgeted and you have no spend down. Our legal view is that that's incorrect. That they shouldn't require a new budget from DSS. But you also need to be very confident in your budgeting skills, right? You know, it's like, don't try this at home if you feel you can't do that. So we do want to just tell you, maybe just should we just flip to the spreadsheet, Kelly, and just show that the budget of the case that we just looked at. So everyone has, as a handout, this Excel document, and you can see on the bottom there are tabs for a single budget, a couple's budget, spousal refusal. The yellow cells are ones that you fill in, and the pinks are automatic calculators. So this is the budget we just looked at, where we see what their total income is, and Kelly put in the couple's Social Security, but then it just automatically added it. Kelly you put in the Part B premium, because it's your and the client's decision. Are you deducting the premium? Are you counting it, or are you not going to count it? So in this case, we've put in the Part B premium, we put in the Medigap. They have a lot of deductions, $700. With all those deductions, they are under the limit. But that's where you can play with it. So Kelly, what happened? Look at, we just took out the Part B premium. Let's say, so that's how you play with the budget and see what would happen if the client wanted Quimby. Look what happened. Their spend down appears at $297. So this is a tool for you to help the client decide, is it worth it for you to keep your trust open and pay $297? That's $297 more income than you had, because it was being taken out of your Social Security check. So, you know, as you play with this, you'll see how it works out. And what we have in the appendix is all the examples we've given all along. Kelly actually entered them in the spreadsheet and printed out examples of what the budget would look like if you used our spreadsheet to do them. So you can look at them and think about, and you can practice yourself using the spreadsheet, because we think it's a wonderful tool as you counsel people through this. All right, back at the all right. So now what happens? Let's say you do this strategy. You don't ask for these people who have a spend, they've already been rebudgeted by DSS 3 years ago. They have no spend down. They're putting in the pool trust. You've advised them, you don't need the pool trust anymore. You're well under. Just stop depositing it, everything we said. So then what will happen? Beginning this spring, March and April, they'll get their renewals. Now, as we said, it's a 12-month cycle. This client might not get a renewal till next December, okay, or later. So as always, when you have a pool trust, you must include a verification of deposits. The shorthand is VOD. Some of the trusts have online portals where you can just download it, and you have a nice PDF that you can attach to the renewal. If the estimate of the spend down was correct, you used our spreadsheet properly and all of the information we're giving, then when when the client reports their 2023 income and says, okay, here's what I'm putting in now to the trust, the budget should come out correct, that they have no spend down and they have QIMBY if you're seeking QIMBY. So this is how we're suggesting you can help people reduce their spend down without bothering to request the rebudgets from the state. Just a tip to estimate the spend down conservatively. As I said, you want to leave a little wiggle room, and don't close the trust if you're really close to the line, but you can reduce your deposits. Now, just to throw in a little monkey wrench in, one thing we don't know is the state hasn't told us when people request the rebudgeting or when they do the renewals, will they be retroactive? Like, will they rebudget all the way back to January 1st? In these pooled trust cases, it doesn't matter because they already have a pooled trust. They already have a zero spend down. So there's nothing for them to lose. There's nothing for them to gain by the budget being retroactive. But the people who have a spend down now and they're paying it in, for them, as Kelly pointed out, it's really in their interest to get that decreased. And so they're the ones who should be putting in the request sooner. And we are hoping that the state will say that those requests will be budgeted retroactively to January 1st. Okay.
Our second CLE code is pooled income trust, what we've just been talking about. Pooled income trust is the second CLE code. You must insert the 2 correct CL codes into the form. It's a forms.office.com in the chat in order for Valentina to give you and her team to give you CLE credit. So the second CLE code is pooled income trust. Do not write it into the question and answer as I'm seeing here. That will not result in CLE credit. You must complete the form that is in the chat, forms.office.com, to a specific URL to get the CLE credit. All right, we can hold it up there for a little while longer, and then I have been sort of reviewing the questions, both about pooled income trusts for you and Kelly, and also some general ones. The form, I just see a question, is in the it's in the chat. We posted it a few times. I'm sorry to say there are no CEUs for licensed social workers. This is CLEs for attorneys. Okay, that was the second code. So let's move on to some questions. I guess you could leave that up because I'm just going to tell you guys the questions, okay? So one question about pooled income trust budgeting. Will pooled income trusts be advising beneficiaries of the new income limit?
I did receive an alert from NYSARC that they were doing a webinar. I think it might even be tomorrow on the new income limits. I don't know if they're giving the same advice we're giving. Don't forget, a lot of what we're presenting here is legal strategies based on our knowledge and experience. So not everyone might agree with some of our strategies. I mean, you're coming to us to hear the benefit of our expertise. So, but it's not guidance, right? It's our opinion. So you might hear something different from a trust. We hope that they're doing education on it, but there's about 40 trusts. So, but I did see that NYSARC is doing a webinar on it. So,
and I just see something here. Someone posted, Life Trust has sent letters to their beneficiaries.
Nice.
So another question is, if you close your pooled income trust, does the money become your asset, the beneficiary's asset?
Kelly?
I would think that the money, once you close out the account, stays with the pool trust organization. They can't disperse money back to you, so that's why you would want your balance to be as close to zero as possible. But that's my interpretation.
Right, and how do you do that? I think we said a few times, how do you get the balance down to zero?
You would submit medical, you would submit not medical, you would submit bills. So all of a sudden, you know, you might have a bill or you might have a credit card that you have a receipt for.